When we see the world through our own eyes. I mean, and that's fabulous, right? Because it gives us perspectives and our own perspectives, and it gives us an understanding that frankly nobody else has, and it allows us to interpret our world in like all these wonderful ways that mean a lot to us. So we begin thinking about how we see the world. There are all these other people who are also seeing the world. And they're seeing the world in their own ways, through their own perspectives, with their own eyes. And the thing about those perspectives is that they allow us to focus that world, right? They allow us to say, what does this mean? And they help us to frame what we see. You think of the director and the framing the shot, but the thing about framing the shot is that thing that's in the middle of the frame, that's what's important. And then everything else just kind of falls to the wayside. We say that that's not important. We act like it doesn't exist because it's not within our frame. And the thing is that our frames and our perceptions are really brought forward by our social identities, by the cultures in which we were raised, and the ways that we see ourselves. So when we talk about social identity, we're talking about the groups to which we belong. And there are many groups, and the fact is we have multiple identities, and a lot of times we reduce them to 2 or 3. She's black, she's female, she's straight, she's gay, she's Christian, she's Muslim, we reduce, but we have all of these identities that have an impact on how we see and how we frame the world that's around us. And so how does that impact you as you are working with others? How does that impact you as you are thinking about the work that you're doing? How does that impact them working with you? Because everybody is bringing their own identities to the table. Well, to think about that, the fact that these identities have a profound influence on who we are and how we behave and how we see things. And that influence is both conscious and unconscious. And it has an impact on me, on you, and on you with me and me with you. And then us with others. I mean, it kind of keeps pinging back and forth and back and forth. And lastly, as we think about our leader identities, if you are working with a patient in that moment, you are the leader. How we lead and how we understand leadership is often impacted by the groups in which we inhabit. When we talk about social identity, one of the things that we as humans do is we categorize things. We begin to identify with certain groups. I'm identifying with the mother group. You're currently in here identifying with the nursing group, right? And then we make comparisons as people and we say, this group is better than that group. And what we are trying to do now is say, how do we maybe kind of step away from that one? Because that one may not be working for us so well. So as we talk about identities, we want to think about this. That we all want to fit in and be unique. There's kind of a dichotomous approach. There's part of me that just wants to be me, and there's part of me that wants you to accept me. And some of our identities are visible and some of them are not. We have to also recognize that some identities are taboo, some are not, and that taboo status may change. But it's also contextually driven. In some places, that taboo may be gone. In other places, you can still be killed. So these things about identities are real fluid. One of the things that is important is we think about our images of leadership are connected to identity. We talk about identities that they constantly change. That, I once had an identity as a young woman. That one's gone now. Fortunately, we're hanging on to Q. I don't know, right? And so we have identities that some are more important and helpful to us than others. The thing about our identities, though, not only do they help us to see, but they also can blind us. They can stop us from seeing what's going on. Again, we framed our picture, and everything outside of that frame, if we're not careful, can become unimportant. And it blocks our perspectives of what other people are experiencing. And sometimes, instead of it being about the patient, and wherever you are working in nursing, ultimately, it is about the patient. It is about how do we help these people, and then more broadly, how do we help these communities, the nation, have better health. And the thing is, they're bringing their own identities to this. Those people that you're working with, they're bringing their stuff too. But as the person who is in the leadership role, in many ways, you have the opportunity to dominate, to let your view sway. Because when we're dealing with our patients, as I said, they're bringing their own stuff to the table, and a lot of time what they're bringing, sometimes it's fear. A lot of times people are coming and they are invisible to systems. And if we want them to have better care, then how do we begin to bring them forefront so that we can see them? There's a lot of distrust in the system for many of the people who are outside of that. We're talking about different languages. So there are different languages in terms of natal languages, different languages in terms of, do I even understand what you're telling me about my condition? It may be not interpreting it your way, but interpreting it their way. So what are some of the things that we can do? One is listen more intently. Ask questions more thoughtfully. Ask them about their culture. How do we create opportunity for two or more way conversations? How do you not talk at the patients? How do you engage them and bring them into that conversation? How do we challenge our own perspectives? Ask why. What are the major cultural groups within your radius? So if you know that there are certain big groups, then how do you educate yourself about those groups and the cultures of those groups so you can begin to understand, or at least begin to ask more intelligent questions? How do we continue to think about the questions that are not asked? Maybe we have someone in the group who's the designated person to say, okay, what are we not asking? How do we bring this up? How do we put in maybe some systems to help us to do some of these things?